moderating today the session, and I'm very glad to be here. Let me start first by introducing Dr. Kamal Yusuf Tami. Dr. Kamal, he's a faculty member in the Mechanical Engineering Department at MIT, where he is the director of the Mechatronics Research Lab. He is also the co-director of the Center for Complex Systems at MIT and KACST, and he is also the director of the KACST MIT Ibn Khaldun Fellowship for Saudi Women, the organizers of today's event. Good evening, Dr. Kamal, and we are all great to have you here today. So if you can please tell us more about the fellowship and the seminars that you and the team are organizing.
Yeah. Assalamu alaikum. Hello, everyone, and welcome to today's webinar. Shukran, Dr. Seba. Yes, I also would like to thank the panelists for making the time to prepare and also be part of this important webinar. Also, our team from the MIT side, Teresa and Dorothy and Nadia, for putting a lot of these programs together. So these, webinar series are meant, to inform, the public at large, and at the same time, to highlight, all the contributions from our fellows. These are all of the, Saudi women that were like handpicked, both by KACST and MIT. And a lot of them have spent time at MIT at least a year, some of them a year and a half, and then others, I think 2 years, and working in many different fields. So this is maybe a brief summary about the objectives, of these webinar series, and then we will have the different topics, as we go forward. Maybe a brief comment on the program, maybe for those participants, who are not familiar with the Ibn Khaldun Fellowship program. So it was established through the MIT KFUPM, or King Fahad University of Petroleum and Minerals collaboration. This was maybe almost 12 years ago. And Saudi Aramco, expanded the program in 2013. And then 2018, or March of 2018, we moved it to KACST, and now it's been with the sponsorship and collaboration with KACST. And the last word is, I want to let everyone know about the capability of our fellows, very, very distinguished women, all of their contributions that they have done at MIT, both in the technical and non-technical aspects, and more importantly, the great work that they are doing back in the kingdom. So we plan to continue, of course, to work with the previous fellows and also with the current ones, and all of this for the benefit not only of the kingdom but for mankind. Thank you, and sorry for taking too much of your time, Dr. Seba.
Thank you very much, Dr. Kamal, for your support always for the science and the ladies in science always. And we are happy today here to have Dr. Sufana AlMashhadi, Director of Innovation Center at King Fahad Medical City, Dr. AlSalamah, Professor at King Saud University, and Dr. Mariam AlEissa, Head of Molecular Genetics Department, Saudi Centers for Disease Prevention and Control, Dr. Sanaa Attas, Associate Professor at King Abdulaziz University, and Dr. Malak, Althagafi, Physician Scientist in Clinical Pathology and Deputy General Director, Research and Innovation at KACST. Welcome our guests. It's our pleasure to welcome you all here today. As Dr. Kamal mentioned, our speakers are coming from different backgrounds and they are affiliated to different top research institutes and universities in the kingdom, but they share a common interest, which is their passion about science and driving change and innovation in Saudi Arabia. Thank you very much for being here. And it will be great if each one of you could introduce herself to the audience with your background and your interest and your current work. Let me start first with Dr. Sufana.
Thank you, Seba. Assalamu alaikum. Good evening, everyone, or good afternoon, wherever you are in the world. Thank you so much for having us. Thank you, Professor Kamal, for your great support, and the MIT Ibn Khaldun Fellowship management team, and KACST for supporting this amazing program. So I'm really passionate about science, and specifically about translating our information and our understanding of the human brain. And specifically my background, so I gained my PhD in neurodegenerative disorders, which means how do we understand more what is the aging process, and how can you preserve your cognitive functions for an even healthier, better life. So there are many aspects of the brain that really fascinates me. Recently, I have been involved in transforming or translating the research work into more sustained kind of impactful projects that can have return of investment, or can even transform from the bench to having like a project that is tangible and that is accessible by the community and by the society. So I'm very much interested in this area specifically. However, I'm still practicing as a neuroscientist at King Fahad Medical City, and I'm maintaining my research affiliate with MIT.
Thank you very much, Dr. Sufana. What about you, Dr. Shada?
Assalamu alaikum. Thank you very much, Dr. Seba. It's a pleasure to be here, and I thank you for organizing MIT Ibn Khaldun Fellowship for organizing this. Thank you, Dr. Kamal and Dorothy, and the rest of the team. So in a nutshell, I am an academic, a mentor, a public speaker, an author, an entrepreneur, a former Ibn Khaldun MIT fellow, and also a patient centricity advocate. Now, currently, I am an assistant professor of healthcare information system security at King Saud University in Riyadh. I'm also a consultant at the Department of Digital Health and Innovation at the World Health Organization in Geneva. And since the beginning of the pandemic, I've been helping and consulting for the National Health Command Center in the Ministry of Health in Riyadh in order to support with their COVID-19 response. I also serve on a number of national and international boards in relation to emerging technologies like blockchain, artificial intelligence, and information security, including the Organization for Economic Cooperation and Development Blockchain Expert Policy Advisory Board in Paris, the International Association for Trusted Blockchain Applications in Brussels in Belgium, also the DevMaster AI training company in Los Angeles, California, and finally the Saudi Association for Information Security in Riyadh, Saudi Arabia. Over to you, Seba. Thank you very much.
Thank you very much, Dr. Shada. What about you, Dr. Mariam?
Hi, I'm Mariam AlEissa. I used to be a fellow at MIT at McGovern Institute of Brain Research, and I'm also affiliated with the Broad Institute of MIT and Harvard. Currently, I'm working in the Saudi CDC, and I was fortunate during my time in MIT to award a number of certificates in innovation, entrepreneurship, and leadership. This implicates on my current work, where I'm trying to establish the molecular genetic department in my job.
That's great. What about you, Dr. Sanaa? Hello, Dr. Sanaa.
Okay, thank you very much for this kind introduction, Dr. Seba. And of course, first of all, I would like to welcome you, Professor Kamal, and all the panelists from the Ibn Khaldun community and fellowship, Dorothy, Teresa, and the rest, of course. Okay, I would like to start in another way. I will start by explaining the meaning of translational medicine, since some of my students are with us and they've been asking me several times about the definition, the exact definition of the translational medicine. So it's an interdisciplinary branch of biomedical field as defined by the European Society for Translational Medicine. It's supported by three main pillars, which is the bench side, bedside, and community. And the goal of it is to combine disciplines, resources, expertise, and techniques within these three pillars in preventive, prevention, diagnosis, and therapies. Accordingly, translational medicine is a highly interdisciplinary field. However, the primary goal of which is to improve the global healthcare system. As a researcher with background in virology, having my postdoctoral fellowship training in MIT, it has strengthened my research capability in public health. I have carried out research activities that involve multidisciplinary experts, which in turn is a form of translational science, in a naturally occurring diseases, and applying the findings of or from basic science research to enhance health and well-being in humans. For example, I was a principal, and in some other researches, I was a co-investigator to a number of researches that afforded me a unique interaction with the concentration of infectious disease and public health experts with an array of expertise in different disciplines. I hope that the interaction between those colleagues will afford me to play a vital role in the development of preventive and control of the current COVID-19 pandemic. Last November 2019, one of our articles was nominated to win the Sheikh Zayed Award for Alternative and Prophetic Medicine in Abu Dhabi for a research conducted in German laboratories on the use of the active substance PMF extracted from camels as an antiviral drug on human cells. Also, other recently published papers were find any relationship between some substantial vaccines and the likelihood of COVID-19 infection all over the world. Thank you.
Thank you very much, Dr. Sanaa. And finally, Dr. Malak, about you?
Hi, everyone. Assalamu alaikum. Good evening. I would like to thank the MIT Ibn Khaldun Fellowship for having me today as a panelist. I'm a little bit different than all others. I'm actually not an IBK fellow, but I'm a fellow of their natural competitor across Charles River. I'm actually a Harvard alumni. What is my background education? I graduated from medical school at King Abdulaziz University. I did my postgraduate medical education at Georgetown, at UCSF, at Harvard, Brigham and Women, Boston Children. I also did my MBA in medical management at Johns Hopkins. Now what I do, I can define myself as a management executive and physician scientist. As management executive, currently, actually, thanks to KACST and their support to women, so now I'm actually Director General of the General Directorate for Research Development and Innovation Coordination. I was, as you introduced me, a Deputy Director just last month for Research, Innovation and Support. So that's what I do in KACST, and I'm also a member of many of their committees, national and international committees. What I do as a physician, I'm actually the director of satellite research administration at King Fahad Medical City, where I oversee 3 departments. Department of Genomics, I'm actually the founding chair of it, and a director of the Saudi Human Genome Satellite site there. Also, I oversee the National Neuroscience Research Department and Research Collaboration Department. As a physician, I'm a consultant subspecialty in molecular genetics, neuropathology, surgical oncology pathology. So this is me and a nutshot, and I'm advocate for a woman in science, and I'm very glad to be here today to join you as a panelist.
Thank you all ladies for the nice introduction. It's very impressive, and I'm very happy to hear that me as a scientist, you as a woman, as also as brave scientist. So before we start, I would like to mention to the audience that if you would like to ask questions before we start, you have the feature Q&A where you can post your question and it will be answered at the end of the seminar. So people are asking maybe what is translational research? Additional to what Dr. Sanaa said, translational research is the process of applying knowledge from basic biology and clinical trials to techniques and tools that address critical medical need to improve the health outcome. And nowadays, the science and innovation landscape in the Kingdom of Saudi Arabia is currently undergoing massive restructuring of its research, development, and innovation ecosystem. This change is impressive and rapid for the last 5 years, and it's part of the Vision 2030. So since all of you are coming from different scientific background, could you please tell us how your background or your scientific contribution can be more related to the translational research in the healthcare field? Let's start with Dr. Shahad. Sorry, Dr. Shada.
Yes, thank you. Okay, generally speaking, I've been a contributor to the healthcare sector modernization movement and policymaking at the national and international levels. That's for better disease detection, prevention, and also treatment. Now, specifically using emerging technologies. Therefore, I have founded and co-founded a number of initiatives that mainly aims for solving, local health problems in Saudi Arabia with the potential of a global impact. And that is at the heart of my research agenda. That's why I collaborate with different subject matter experts and decision and policy makers in Saudi Arabia, from the Ministry of Health, the Red Cross and Authority, secondary and tertiary hospitals, pharma, dental clinics, also research centers and universities. This is to mainly create trusted ecosystems where we all as a team, and with my students, we build solutions that can address burning and pressing problems that keeps those people or those experts up at night, and also to help them make informed decisions. We develop throughout, in that ecosystem and team collaboration, we develop solutions with a mixture of emerging technologies, including blockchain, artificial intelligence, wearables, mobile technology, and many others in order to enhance the experience of patients and those other stakeholders involved in the healthcare ecosystem. Thank you. Over to you, Seba.
Thank you, Dr. Shada. What about you, Dr. Sufana?
Yeah, so I have been recently assigned as the director of the Innovation Center at King Fahd Medical City, which is considered as one of the main biggest tertiary healthcare hospitals in the kingdom. And as we are looking into transforming our healthcare system into a more human-centric approach, I have dedicated my skills and expertise into trying to find initiatives that will align people, align staff and patients to do this kind of approach. In other words, I'm very much interested in bringing people together, bringing the minds together, and working around frameworks that will surface challenges in the healthcare system. And then we together as a group can find the better solutions. So we use specifically design thinking around human-centric approach, which is considered a different kind of research approach, a qualitative kind of research, where you really need to go dig deep inside into the services and the systems and the blueprint of the hospitals and the journey of the patients to try and understand where are the pain points of the system and the customers, whether you define the customer as a patient or a staff or a member of a family. So currently we are working into educating King Fahd Medical City staff and frontliners specifically how to use design thinking as an approach to surface the challenges and then bring the best solutions out of that. This is just the beginning of the pipeline of innovation. Once you have the solution tested and prototyped and iterated and in place, you then really need to test for patent or intellectual property and, protect those rights for those inventors. And after that, you need to commercialize this kind of product and hopefully get it licensed. And, you can go ahead and start as a startup and mature this kind of project to even be scaled up outside the hospital. So this is basically the main kind of research approach that I'm doing. It's more about human, it's more about gathering qualitative data from the system itself to try and define challenges for better solutions.
That's great. What about you, Dr. Malak, since you are a physician and scientist at the same time?
I think 2020 was one of the busiest years in my life as a physician, as a scientist, and even as executive. I was trying to make it a little bit simple, so I will just dissect it more. So as a physician, pathologist, I've been involved in the selection and implementation of different molecular diagnostic assays and tools and signing out some of these reports. So that's my role as a physician. As a scientist, a researcher, I am the primary investigator with another wonderful lady in a project looked at the host genetics of COVID-19 patients in Saudi Arabia. So from the international figures, we know Saudi Arabia ranked third in the lowest country with fatality COVID-19, around 1% only that people who died from actually COVID-19 in Saudi Arabia. So we're studying different genetics, variation and factor, what could be the cause of this. And we have very exciting results, which will be in preprint in the next few days and hopefully online in the journals after that immediately. And also been working as a co-PI with different scientists here in the kingdom. It's KAUST, King Abdullah University, Science and Technology, and others, in validating new diagnostic tool, mainly point of care one, using different genetic technologies like CRISPR, for example. The paper was online a few days ago called iScan. You can find what we do. Basically using CRISPR technology to come up with a faster lab-free kind of approach and very cheap approach. The other one is working with using peptide to techniques to also come up with a very accurate, more sensitive and specific COVID-19 rapid of care testing. So that's what I do as a researcher. Now, as executive, that was the busiest part of my life this year. From the beginning of this, I've been working very close with our president, Dr. Attas, and the VP, Dr. Abdulaziz, in developing a comprehensive strategic innovation program related to infectious disease action platform in Saudi Arabia. This is the heavy documents. Some of it will come online in Lancet Health soon, and other will went already to higher leadership for review and implementation, hopefully. The other one, I've been also involved heavily in my prior position as a VP of Support and Innovation, Deputy Director of Scientific Support and Innovation. I work heavily in developing the program that's called Fast Track for COVID-19 Research, implemented by KACST. Received over 500 applications, funded 50 for over 30 million riyals. The idea here is to come up with the solutions for COVID in different areas, including diagnostic, AI, surveillance, epidemiological surveillance, etc., within 6 months. Other thing I did, we did establish a collaboration between KACST and Princess Noor University to do accelerating testing within 8 hours for all passengers going through King Khalid International Airport, and it was also a few days ago was announced in the news. Finally, at least what related to COVID and other work was all the work we've been doing with the S20 as part of G20, because Saudi Arabia is the host this year, and Dr. Anas is the chair of S20. So I've been working in Task Force 1, Health, Future of Health, and also in the policy paper, as well as we'd love to have all of you as attendee to the next week last webinar, Women in Science, where I will be the moderator, and we have extraordinary distinguished women from all over the globe. So that's me in a nutshell, what I've been doing in this year.
Actually, this is very impressive. I know 2020 might be hard but it's still very impressive, I can tell that. So what about you, Dr. Mariam?
Well, I don't think I have much as everyone else, since I just arrived like last April and we faced this pandemic. However, I would like to talk about my experience in translational medicine. I was working in research, whether in MIT or during my PhD, in finding a genetic variation associated with certain phenotype. And this kind of research take like a multidisciplinary action involving from like taking the sample from the patient into the lab, and then from the lab doing functional biology, bioinformatics, and pathway analysis, and from there back to the clinic where there's other stuff will be involved, and the patient himself, like observing, trying to create diagnostic tool or medication for a certain problem.
Thank you very much. And last but not least, Dr. Sanaa.
Okay, since I'm an associate professor in virology, most of the efforts are being divided between teaching undergrad students and postgraduates, applying for grants. I'm working with my students and other colleagues in a number of research activities that involve multidisciplinary experts, which in turn is a form of translational science, and applying, of course, the findings from these researchers to enhance the health and well-being in humans.
Thank you very much. Actually, it's very impressive and informative to see how can different backgrounds serve for the same need or the same scope in the translational research area in Saudi Arabia in terms of science, research, innovation, and techniques. But maybe we would like to know what is the current state of translational research in the kingdom. Maybe Dr. Malak, you can help us with this question, because I think you are more open in your field and you're exposed to different areas. So what is the real state of translational research in the kingdom?
So we'll focus only on this in the healthcare for this session. So if you would imagine with me, as many of you know, when we talk about the innovation system, ecosystem, we think about three parts. There are the research, which is mainly basic research done by the academic, usually university, get a paper out of it or patent. And then we have the development, which is, I translated here as a translational research, which is, for example, healthcare means we do clinical trials, and also we do, for example, prototype for medical devices, or for example, the platform, administration platform for diagnostic tool, or etc. And the last one is the industrial deployment or commercialization. So we'll focus on the middle one, translation research or development part of it. Where we are today in Saudi Arabia, I will give you a very honest answer. We've been doing great in the R part. We are doing well. We are ranked around, if I remember, 32 or 30 in index Nature Index. We're one of the best countries in getting paper in high impact journals, even in healthcare. Now, when it comes to development, this is, people call this area the valley of death, and this is true. Because this area where we have limited fund from the private and public system, and it's even worse in Saudi Arabia. For example, number of clinical trials that I just told you, it's one of the translational area. We only did 400 clinical trials over the last 10 years in the kingdom. Compared, for example, Singapore, 1,700, India, 2,800. I don't want to even say what the number in the US, but can you guess? 80,000. 80,000. So we still have a lot to go with this kind of translational research. Publication, I told you we did well. It's not a large in quantity, but in quality, we did around 1,300 papers in 2017 related to healthcare. Average citation around 4, so this is good. Now talking about patents, what we did, so if you looked at this information per one, how many patent you feel per 1,000 researcher, we did actually very poor. the last 5 years, only 48 chemical patents, which is not acceptable at all. So here where we are today in this healthcare, and as I mentioned, this is a global problem. This is not a Saudi problem, where both government and private sector have to work together to build infrastructure, because this kind of infrastructure labs is different than academic labs, and also build a human capacity in this area, and build more coordinated, integrated effort between the different stakeholders, and build more regulation that help everyone to do well.
So I think, from my opinion, there is a great effort from the kingdom to support research, but maybe the strategy should change, or we need to do a lot to advance the translational research. So it comes to my mind, what do we need to advance the translational research, or what is the gap? Is it, for example, the communication between universities and hospitals and companies to work all together to reach a specific target? Or what do we need to do in order to develop the developments and manufacturing in the kingdom by attracting big pharmaceutical companies? Maybe Dr. Sufana can help us answering this question in order to think what can be done to improve or advance the translational research.
I think it's a very critical question, and as Dr. Malak was saying, it's a global issue. It's not only local one, but the formation, as Dr. Malak was saying, of an ecosystem that harness and supports and embrace this type of research that is very impactful. This is what we need. So we really need to have a better kind of communication, which comes in the form of regulations and rules of engagement between the academia and research, between the policy generators and regulators, or المشرعين, منصات المشرعة, and then lastly, the commercial side or the industrial side of producing those products and maintaining them into the translation side or the bedside. I guess that Saudi Arabia is one of the countries that very much focus about the input of things, the number of research projects, the number of patents, but we don't necessarily think about what is the real impact on the society, because we don't start by addressing the gaps and the challenges and the needs. We think about solutions and our assumptions and our kind of conclusions, and then we work on them. But the moment that we try to transform those patents into real life projects, we find that they are not being able to sustain commercialization because they haven't addressed a job, or they haven't addressed a need from the beginning. And that's why, you know, it's even in the Global Innovation Index of Saudi Arabia and the rest of the world. Gladly this year, Saudi has تقدمت or تحسنت or advanced by 4 levels. Last year, it dropped about even more than 6 levels, because it shows that we focus so much on our input, and we focus a lot on the number of patents that we are producing, but we don't focus much on the impact and on the output. So I guess by real communication and addressment of, specifically we're talking about translational research in healthcare, if we start by working on the challenges and the obstacles first, and then we go back and form our projects in a way that addresses those challenges, I think we would see better impact and better sustainability.
Yeah, I totally agree with you. But what in terms of education, maybe Dr. Sanaa, from your academic point of view or experience, do you think creating new tracks like MD and PhD program where medical doctors are also involved in science and research, it can be more critical, more beneficial, or do you think we have already the human power, but we need just to change the strategy?
Yes, like I think yes, indeed, why not? Like I found that top universities worldwide are doing the same thing. For example, the University of Edinburgh, UC Berkeley, UC San Francisco, In England, we find the University of Liverpool, King's College London, Imperial College. Like they're all designing to cover major areas of modern translational science, including drug development, genomics, and development of the skills related to research and data analysis. It also improves the ongoing knowledge and skills for clinicians and scientific professionals at all levels. So I think it will be an idea in the right direction if it really happens here. So that's my answer.
Yes, I totally agree with you. And actually, talking about translational research, maybe it's more realistic if we give a clear example of what's happening. And I don't think there is a good example better than COVID-19, because it's science, it's research, and finally, the entire world is trying to develop a vaccine. So today we have COVID-19 pandemic, and many countries are working toward different strategies to develop a vaccine or improve the diagnosis of the virus, or even establish technologies that's needed for facing this pandemic. And now it's the time to move faster than ever, as they say. So here where it comes the translational research. And we know that in Saudi Arabia, we contributed a lot to face this pandemic in terms of prevention and also supporting research. So maybe Dr. Mariam can tell us from her experience in terms of research fund and working in research, how did Saudi Arabia face this pandemic?
Well, on research aspect, the government funded generously research during the pandemic through different governmental institutions like KACST, KAUST, and the Ministry of Health, Ministry of Ministry of Education, KMARC as well, and the CDC have been involved as well. This is not only on a statistical or, let's say, surveillance level. It was beyond than that, involving wet and dry labs by creating a number of innovative tools, like if I'm going to talk about the artificial intelligence, where there's number of ideas have been proposed and a number of stuff have been presented, like applications like Tawakkal and Tadamman and the Saudi dashboard as well, was one of the things that have been produced during this pandemic. And beyond that, going to the lab, a number of let's say, attempt of trying to find a vaccine as well have been established in different institutions. Innovative ideas like creating, as Dr. Malak said, a diagnostic tool, which is cheap, available, used as a point of care, have been established by KAUST, which called, I think, iScan. Also on a clinical level, anything have been produced worldwide, have been also implemented. It's like trying to import any new therapeutic method or medication to solve the problem, like using plasma as a treatment, taking those plasma from post-infected individuals and treat the ones that those who's in a critical condition. Also, a number of research have been applied, whether in the virus or the host, and I think Dr. Malak talked about the human genome initiative. And also, I think Dr. Sharif Hala mentioned something, which is like collaboration. Yes, there is some collaboration between institutions. However, I think we need to do this in a higher level. And we need regulations as well. Since everyone, I think every institute wants to take the lead in something. However, this is not about institution. This is about national security and a pandemic. Yeah, that's it.
What about you, Dr. Sanaa? I think from your experience, you can tell us more about collaborations, whether with the universities or Ministry of Health, to face the pandemic.
Yes, indeed. So since the beginning of COVID-19 pandemic, the Kingdom of Saudi Arabia has stood up to tasks of finding those that are infected with the virus and treating them. Efforts are yielding fruits in that the number of cases daily in the cities of Saudi Arabia has continuously declined. Light must be directed, honestly, to the government support for the Saudi University by giving opportunities to researchers with financial support to conduct research from several disciplines to confront this pandemic. King Abdulaziz City for Science and Technology, which is KAUST, and the Ministry of Education, represented by, I think, 17 universities, if I'm not mistaken, or I think it's between 17 up to 21. And the Ministry of Health as well have launched grant programs to support COVID-19 research. King Abdulaziz University was able to isolate the virus. Also, I have to mention that also the Ministry of Health in Saudi Arabia continues its efforts to combat the COVID-19 pandemic, as it has already originated efforts to develop an effective vaccine for the disease. Moreover, the Ministry of Health also is conducting experiments and research in vaccine development. Announcements has been made that there will be a clinical trial for a vaccine against the virus will be conducted in the kingdom within the framework of the cooperation agreement between Kingdom of Saudi Arabia and a Chinese company. I think it's CanSino and other collaboration as well, which managed to develop a vaccine against the virus. I think that the first and second phases of the vaccine trial has been done in China and other countries, while the third phase will take place in the kingdom. Also, the Ministry of Health has stressed that the launch of the study will be announced very soon. And this step is a continuation of the studies and research at the Ministry of Health, which often conducts in this field. So it has also recently cooperated with the WHO to conduct an advanced multi-center clinical study in 7 hospitals in the kingdom to combat the spread of the novel coronavirus pandemic. So honestly, the Kingdom of Saudi Arabia is making a great deal of efforts to keep the citizens and residents safe from COVID-19 threat. Over to you, Seba. Thank you.
Thank you, Dr. Sanaa. Actually, it's very impressive to know all these contributions behind the screen and what the Ministry of Health and the others are doing in order to face this pandemic. Sometimes it's not said, but it's good to know what is the real state. But what about the technologies, Dr. Shada? What about employing innovative ideas or deploying new technologies? Do you think it can be approached that we did to face the pandemic?
Absolutely. Well, thank you, Seba. I think it's, technology goes hand in hand with, people and human resources, and efforts coming from people, because it's supposed to help people manage things in a better way. So before I start off by answering, let me start off, before I answer this question, by giving a highlight on the current, showing the current state of the Saudi Arabians' digital health strategy, where currently we're actually right at the middle of a shift to fully digitized sectors, and healthcare is on top of that. And having a fully digitized sector with the right infrastructure and resources is actually at the core of Saudi Arabians' Vision 2030. This is mainly, and speaking from one of the perspectives, is to connect the autonomous and distributed information silos, in all sectors, but mainly in healthcare, since it's a very distributed sector, in order to allow making informed decisions, and that's specifically from a technology perspective. Now, although it has been extremely challenging to combat COVID-19, which needs collaboration and information coming from all of those systems, from 13 different regions in Saudi Arabia, without having such infrastructure ready, I think, and I believe, and I'm going to show that in the webinar by explaining how the kingdom has done a fantastic job in utilizing technology and emerging technology in many ways during the pandemic. And I'm going to highlight 2 specific examples to show 2 different stakeholders how the technology empowered healthcare decision makers, whether there have been regulators, healthcare providers or even and payers at one end of the spectrum, and also another example to show how the patient at the receiving end of that spectrum has been empowered as well by the kingdom to manage and combat COVID, do the role or play the specific role. Now, when it comes to decision makers, one of the two examples I want to demonstrate, they were under a lot of pressure, trying to ensure that the total number of cases, COVID-19 cases, does not exceed the current healthcare capacity. And we're talking about hospitals across 13 different regions, in Saudi Arabia. And we're talking about over 33 million people. And so they were equipped during the pandemic with really great tools in order to raise the healthcare capacity line in different hospitals based on available resources, and also increase the capacity line and also flatten the coronavirus curve using or with the use of technology. This is by monitoring mainly the three main factors contributing to managing it from a technology perspective: the workforce, the infrastructure itself, where bed capacity and bed management, also, and thirdly the medical supplies. So these are the three factors where they managed to monitor available supply and numbers and availability and even competency. When it comes to the workforce across all hospitals in the 13 different regions in Saudi Arabia, and that was. With the help of technology, they managed to do that with a level of granularity that can be on a single patient case, where they have to decide where to refer that patient from one hospital in one city to another one within the time frame that would allow him for his safety to the whole country level of management of the bed capacity and medical supply across the country. This is to best manage the resources needed for 40% of COVID cases, according to the World Health Organization. Those are the 40% of COVID that needed hospitalization, depending also, of course, on their severity level. So that's how technology helped decision makers. When it comes to patients, it played a great role in implementing patient centricity through a number of mobile and personal health applications that the government actually implemented and made available during the pandemic, and enhanced some of the existing ones and built other new ones. And they were mostly needed during the pandemic. This is to mainly support patients diagnosed with COVID-19 and their caregivers throughout the treatment journey of those patients staying at home, mostly, which is the 60% of the patients who don't need hospitalization. And there is no better way to explain and demonstrate that than telling it from a patient's personal experience. My father, Dr. AlSalamah, who I hope is joining us today, he developed his first COVID-19 symptom in June the 20th. We all have been, as a family, been in a roller coaster ride for over 60 days until he got discharged from the hospital on July 15 and self-quarantined for 14 days. Now I'm going to tell you the story from his perspective, like he said it, or how he told, according to his journey, it went as follows. So first, and it's divided into chapters. So first chapter, first scene, over a live chat with a Ministry of Health accredited physician using the eHealth app, which we name locally Saha. When he developed his systems, and after a few Q&A exchange between him and the physician, he was diagnosed with COVID-19 and also provided a list of suggested or nominated nearby centers to have a confirmed test in order to check that to confirm the positive case. After that, once he was given that information and diagnosis over the phone, he informed the family and also self-quarantined because he was a mild case at the very beginning. Until his symptoms got worse, this is when he called the National Health Hotline 937 because it was out within working hours. So they answered the phone. The chat wasn't working at the time, but you know, there are options available 24/7 for all citizens. And he spoke to another doctor, or let's say an accredited physician, who also confirmed the diagnosis. That was days later. Prescribed medication to manage his symptom over the phone, and also offered to deliver during their curfew hours when no one was allowed outside their homes, and also advised him to go to the nearest hospital if he did not feel better after taking the medication prescribed, which is exactly what he did, the very last chapter, and he got tested and went to the hospital and admitted there. Now, the funny part is the last application or technology, mobile application he used, which is called Arrest Assured, after being discharged from the hospital, where he was referred to home quarantine. So he was automatically registered in Rest Assured, or what we call it, Tatamman application, where they sent him a flood of messages, and he was complaining about the volume of messages that he received from the application once he left home and went for a follow-up at the hospital. This is when he needed to change his location in the application because they were monitoring the self-quarantine at home. And this was a wonderful example showing, you know, how different tools were used, and he did not have to actually go and see someone about those. Those are all done from home, and he didn't have to leave home unless for hospitalization. Also throughout his journey, the caregivers, generally the citizens, and also the patient himself were given a really good advice and valuable hints and advice from the ministry to help them best manage their case and avoid the spread of COVID. All of these are just, this is one simple example from a personal experience to demonstrate how the kingdom has orchestrated a great technology-enhanced suite to empower personal health for over 33 million people and reduce the burden on their caregivers and also the healthcare system. Thank you very much, and over to you, Seba.
Thank you very much. Actually, it's very magnificent to see how even technologies serve to face this pandemic behind the stage, as they say. But sometimes people do not look at the effort. Sometimes people only look at the outcome, like why we did not reach this stage, why we did not do that. So this takes us to the next question that everyone is asking: where is the vaccine? Or why it takes so much time to develop a vaccine, or although we in the kingdom work on it in a different way, not necessarily developing a vaccine, but characterizing the virus or collaborating with people from the outside. But taking COVID-19 as an example, it's taking almost a year to develop a vaccine, and we are not sure yet the outcome of this vaccine in terms of the side effect, or how friendly is it. And some of these vaccines are taking 5 to 10 years. So my question is, what are the challenges behind the timeline of producing or developing a drug or vaccine in general, not necessarily only in the kingdom? Maybe Dr. Sufana, you can help us answering this question.
Yeah, so obviously we're trying to find a vaccine for a human disease. So it's a disease that is affecting humans, and whenever you are dealing with humans, it's always very complicated, and it's basically like a safety issue that it's taking such a long time. Research is being gradually accumulating very crucial data for us to understand the nature of this virus and all its aspects and how it's triggering our systems. So obviously we can see that the COVID-19 is evolving, it's changing. We didn't understand yet why isn't it affecting children as much as it's badly affecting adults. And we've heard about people and research saying that the virus that affects the Middle East, for instance, is different from the one that affected Europe, or it's different from the one is present in the Far East. So research is still very in its very initial steps in trying to accumulate data and understand the nature of this virus. That's why it's going to take a long time to find the vaccine and test it first. And there are several clinical trials are ongoing as we speak, but I think it's the safety issue that it's taking a long time.
Yeah, I totally agree. And do you think, Dr. Malak, based on all these research and technologies and the association that we are building to face this pandemic, can we use the same approach to use it for facing common diseases in our country, like chronic diseases or infectious diseases in the kingdom, or it's always different and variable?
It's a very tricky question, if you allow me to do. Regarding to your comment and people asking where is the vaccine, this is actually, many of the audience will agree, it's the first time, I think, in a century, the whole world is working on one health problem. We did not see this before, I think, since the Spanish influenza or any of other major things which hit the entire world. And with this, it's taking time. And as Dr. Sufana said, safety is come first. Here, you're not designing a therapy for individuals. So this is not a therapy to cure a disease. This is you giving a vaccine or giving to the entire population. So any small, tiny side effects will have a major impact. Now, going back to your question, the process of developing drugs is not a short process, as you said, 5 to 10 years, sometimes 15 years. And the history tells us, and also the current, did we find cure for all cancer? And we know cancer for many, many, many years. And even with some report before, there is BC kind of cases that be reported. Did we cure it? No. All the cancer? No. Did you cure diabetes? No. Did we cure any of this other common thing? Not only in Saudi, worldwide, no. It's a very complicated process. Many factors get in. Individual genetics, epigenetics, environment, lifestyle, very complicated thing to come up with a treatment or vaccine, a treatment for this complex disease is what we call it. Now, I will give you an example. The life cycle of any, if you want to create a drug, for example, you need a basic research. This can take many years in some diseases to know actually what's going on. And then you reach a drug discovery phase where you're lucky have target now. Now let's test this target. Let's lead and try to understand more and do preclinical study on animals or animals and no human testing at this stage. This is again can take years. Now you're lucky, you pass the preclinical, you go into product development. You want to go to the human testing, phase 1, clinical human, small group, 20 to 100, see if it's safe and the dose, and what is the dose result. Go lucky, move to the second phase, proof of concept, more people, around maybe 300, maybe take 1 to 2 years. Usually drugs who reach this phase, 33% of them will proceed to the next phase. So you lost already 2/3. Phase 2 and 3, again, now you're looking at thousands of people. I'll look at what can side effect can come to you, and usually take 4 years, 1 to 4 years, and not many drugs pass this stage. And even if you're lucky and move to the market approval, it takes some time, and many drugs we know, they've been withdrawn from the market. So this is what we're talking about. This is the journey of any drugs or vaccine. It's not an easy one. So I'm gonna switch example to something that maybe we thought as a genetist at least, and we're very naive on this. When the Human Genome Project completed after 13 years in 2003, we thought we will solve all the genetic issue. We were wrong. Now it's 20 years after almost. And it's really few diseases that we could find some sort of cure. Now at the Saudi, what we did, we realized now, okay, there is enough research being done maybe in discovering. Now let's do the technology development part. And that's what we did with the Saudi Human Genome. It was a technology development part where we brought the technology, trained it, discovered what's common in our population. And now we're moving to the third phase, which is the commercialization, hopefully, by having a product to prevent this disease, because we know it's kind of still a long journey to cure them. So let's prevent them by expand our premarital screening for genetic disorders, by expanding our newborn screening, by having more advanced diagnostic tools to detect these diseases even before marriages, or even very early on when the child is born. So this is where we're starting. And this is, we thought it's not a complicated, because usually genetic disorders are caused by, are monogenic and caused by one mutation. But we still.
Yeah, I understand the pain behind it because I'm a researcher, but I wish I can make all this dialogue in a simple word and publish it to the publics and tell them, look, what is the effort behind that? And still, it's not very clear. It's always critical and very challenging. I totally agree. But what about the economics, Dr. Mariam? Do you think, we know that the COVID-19 pandemic had far-reaching consequences beyond just the spread of the disease itself. One of the aspects is the economic impact. So how can we take a steadfast decision during the crisis to employ innovation, ideas, or new technology to advance the healthcare?
We did a great job actually in Saudi Arabia. Economy was affected around the world, and everyone was trying to find a solution for this dilemma. Nobody knows what to do and which is the best approach to reach. However, in Saudi Arabia, we took a prompt action to create policies and regulations, not only on a health level, also on a governmental level. At the same time, moving the economy wheel and finding solutions to make things active by finding, as an example, making people work from home and regulating work hours, allowing those who need to be on the field for a certain time and others to stay at home. Also, to reduce the economic burden, the Ministry of Health prioritized hospitalization for those who really need to be hospitalized, while the other can be quarantined at home. The testing as well have been reduced in a great amount by using the applications, or where I think Dr. Shada mentioned that, where you can evaluate yourself and know that you need to be tested or not. And also finding cost-effective new technology and innovative idea in the economy. Yes, we did a lot. However, I think learning from this experience is really valuable. We need to take notes and learn from the things happened during this pandemic. And I think one of the funniest things that happened during the pandemic, the mask and sanitizer crisis, where people trying to save as much as they can at home. And this also was a privilege for some of the merchants to not sell in regular prices and try to increase the price. Well, the government played a good role on that, or actually a great role, and it was bonus for us by controlling the prices and supporting manufacturing companies to at least cover the kingdom needs from sanitizers and masks. So we were independent on that. Hopefully we will do in different aspects in technology and other stuff. It's like keeping an eye on the world and observing and learning, and at the same time the other eye watching and monitoring the situation within Saudi Arabia. Yes, we did a lot, but we need to learn and find a strategy for anything in the future. God forbid, but we need to learn.
Yeah, that's really great. And we all agree that this pandemic is surprising and it was unexpected for the entire world. So maybe Dr. Sufana, you can tell us if you think this crisis opened the door for us to think in advance how to face the risk of any future pandemics or any waves that could possibly hit us, which is, I hope, no, in the near future.
As Dr. Mariam was saying, there are lots of lessons learned throughout this experience on a personal level, team level, organization level, and even national level. Yes, it's very hard to predict what's going to happen in the future, especially that specifically dealing with COVID-19, it's something that has never happened recently, and we don't have reference data or memories to, refer our experiences or how did we navigate this challenging time. I'm speaking on the level of organization. So the last pandemic, as Dr. Malak was saying, probably was the Spanish flu, and it was more than 70 years ago, so we weren't even there. So we don't have the kind of experience and the know-how how to navigate this. However, from an innovation point of view, I believe that there are some theories that you could work with to predict what's going to happen in the future. And it's just not in the terms of health crisis or pandemic, but it's to let you know what are the gaps and to anticipate what do you need so you can shape your business towards that. At least you can try and sustain your business in these challenging, highly competitive times. So I can speak briefly about one of the theories that I think specifically in healthcare could be very helpful, is the theory of disruption found by Professor Clayton Christensen. So specifically in healthcare, Professor Clay defines the theory of disruption is that you make the complicated simple and the expensive affordable. So which means that you make the complex healthcare services that is only being provided at the large healthcare complex systems, make them simpler and more accessible so you can include larger groups of people who cannot come to the hospital to get this access to care. They would have access from the comfort of their homes or even from their rural parts of the countries. We can see this acceleration of application happen during the COVID-19, specifically in activating virtual connections and virtual clinics. So this is specifically and mainly the theory of disruption, where you have allowed people to get access to care, not only by coming physically to the headquarters or the healthcare hospitals. So if we have anticipated that we need this kind of access of care for people from their comfort of their homes long time before, and we have activated the systems in a way, we could have navigated this challenge maybe smoother, maybe at least reassuring patients that they are not disconnected from their healthcare providers. I'm not saying that the Kingdom haven't done a great job. Yes, it has done an amazing job in adapting and shaping themselves in a quick way to activate this kind of care. But I see that this is a must. Don't rely on your business as usual as it's going. Try to learn from this challenge and try to mindfully and selectively shape your creativity and innovation in a way that it will serve challenges as we go through.
Yeah, I totally agree. Before we close, do you think, Dr. Sanaa, would you like to add anything regarding what lessons have been learned from COVID-19 pandemic?
Yes, thank you, Seba. So, yeah, can you hear me? Can you hear me? Okay, so I think that this emerging pandemics show that humans are not infallible and communities need to be prepared. So like any other nations worldwide, Saudi Arabia has learned a lot from basic universal precautions like hygienic ways of living and handling infections such as common cold and flu have tremendously improved at individual, families, and household levels. The transdisciplinary One Health approach involving professionals from many disciplines such as medicine, veterinary, environmental health, and social sciences has been suggested as means to limit new infectious outbreaks. Actually, the global experience is teaching that containment measures and the aggressive contact tracing are mandatory to keep the infection under control until an approved treatment or a vaccine is available to the global community. Meanwhile, we learned the lessons of protecting the most vulnerable individuals and rally around the science. And I think that this pandemic has demonstrated the importance of research activities. Back to you, Seba.
Thank you very much. We reached the end of our webinar, and before we close and we reach our audience and their questions, I would like to thank Dr. Kamal for joining us today and our distinguished speakers for enlightening the seminar. We appreciate having all of you here to cover this mysterious and interesting area and to make it more clear for the audience and also for us as researchers from different perspectives, because it was very informative where we think we are sometimes working alone. So we need from time to time to know what is the others are doing and to contribute as a group and not only as one person. So thank you very much for your time. Now I will go to a question, and some are already answered, so some are still.
I think there's a lot that are already answered, but could be answered in more depth.
Yeah, so I'll start from the end. One question for Dr. Malak, why Saudi Human Genome Project is not for public yet? And is there any, the second question, is there any governmental rules or restrictions for publishing human sequencing data to public?
Thank you. I'm not sure why it's not for public. It actually, a project was created for public and for all Saudis. That's the whole goal of it, to be for all Saudis. We now reach over 60,000 samples, all were collected from Saudi patients or volunteers. We have over 400 researchers worked on this project from 72 institutions. So it is open. If there is a dedicated website for it, and any researcher can submit their proposal, and it will be reviewed by the scientific committee to proceed with it or not. But it's public, and it's there is actually another 7 satellite location in different area in the kingdom, in King Fahad Medical City, where I oversee this one, in National Guard, in King Faisal Specialist Hospital, Taiba University, King Faisal in Jeddah, and King Fahad Specialist Hospital in Dammam, and more recently Tabuk University. So a second part is, there is a restriction from the government about the genetics data, and I'm not the expert of this, but there is the National Bioethics Committee takes this issue very seriously. That doesn't mean we don't publish. Many researchers, they publish what they find, but they make sure to de-identify and to keep the privacy of our patient. So we submit in the international respiratory in the databases, and we do it, but it's not open database for everyone, the Saudi Human Genome. It's only the PI can publish what is his work, making sure to stick to all of the ethical rules.
That's great. Since the mic is yours, we have one question from Dr. Sharif Hala talking about collaboration. If there is a way to improve the collaboration, or there is a service through KACST to get away or advance the collaboration that we have, because as he mentioned, we are facing a lot of problems that delay the progress in terms of massive work of paperwork, lack of fast delivery, low fund, and a lot of problems when it comes to the work that we have at the moment.
Yeah, I thank you for this question, and I fully agree. And this is one of the exercise we did this year during the pandemic. We're trying to understand, to know what all the gaps we have in the system. And this was an obvious one. We actually don't have a central body or agency that doing the national research development innovation coordinations at a national scale. So due to this, we have a lot of duplication of resources, and even underutilization of others, and a lot of waste of time for many people. researcher or even international companies to come. So this is what KACST decided to take a lead. It's we're not sure if this will be the only central national coordination administration or not, but this is what was established just last month. And I was lucky to be selected to be the Director General of this new General Directorate for National Research Development Innovation Coordination, where we're trying to address all these gaps and more than this to try to work with the regulators, with the university, with the research institute, with the international partner, national partners, and trying to make it a relatively easy journey for all the researchers at different levels and different parts in the ecosystem.
We have one question. Can you give a side on the future of RNA-based gene therapy in Saudi Arabia? It's an open question. Anyone would like to answer? Maybe I can answer this question. Actually, I can say yes, because this was already approved, like in the US and Europe. But there are a lot of challenges when it comes to clinical trials. The same goes for the CRISPR-Cas9. A lot of improvement, a lot of challenges researchers are facing. Although the technique is there, we know how to design it, we know how to do it in the lab. But when it comes to the advanced stage, when you want to apply it for certain diseases, or you want to apply it for clinical trials or in a patient, still we are struggling with a lot of problems. So as a technique, yes, but we don't know what are the challenges yet. And we hope it can be the real state and can be used for like as a therapy in Saudi Arabia. Do we have other question? Yeah, actually we have one general question that after talking about COVID-19, one is asking, do you believe we are going to have a second wave of COVID-19, and if we are well occupied to handle it? I'm not sure about the second wave, I hope no.
I can, yes. I think the world already is starting to face a second wave. We've been seeing data from Europe, France, Spain, and UK. There is already another surge in these countries. And I don't want to be, I don't want to lie about it. I think it's coming, but I think the good news is we are better prepared this time. The first wave hit the entire world. We're not ready for it at all. I think now we're more careful, and also we'll continue to follow this precaution. Wearing a mask, it doesn't cost anybody anything, but it has a huge impact. I mean, one paper just published 2 days ago in New England, which I love the idea actually. It said this is our way to get crude vaccinated. Being involved in a small, maybe particle of the vaccine through the mask will build immunity over time. And I love this idea. It came from UCSF, one of the authors. Maybe this is a true way to go until the real vaccine comes. But just wearing the mask and keeping the distance, it will keep us safer, inshallah, all of us and our families.
Yes, if I may comment on the question and provide an answer and comment and second you, Dr. Malak. We've seen the measures specifically in Saudi Arabia where they're actually locking all ports where travel is banned, and I think this is mainly a precaution to prevent a second wave. So whether the answer is yes or no, I think they're doing the greatest effort to try to prevent that from happening. And at the end of the day, the government can put some technologies available and a lot of efforts in granting funding projects and researchers to work on related topics that can specifically target COVID from an individual perspective, maybe the disease itself, or could be to help support the management of and combat the disease. But at the end of the day, all of us play a great role, like Dr. Malak mentioned, that can help us contribute to this overall effort. We cannot have a successful story to tell at the end of the day if we don't all participate and collaborate collectively to achieve that.
Yes, thank you very much, ladies. I think we are out of questions, and we still have few minutes before the end of the webinar. So I would like to thank all of you, and would like to hear from you if there is anything that you would like to add, insights, anything that you would like to add that we did not maybe cover during the webinar. Please feel free, the mic is yours.
Probably, maybe I would add something about this previous questions about how are we prepared to face another wave of COVID-19. I would say on a strategic level, King Fahad Medical City is just about to launch its new strategy for the next coming 5 years. And they have added, the strategy team have added a main program as a disaster management, and they have given it a lot of weight, and we will dedicate a lot of resources to handle that. So I guess that we cannot prevent ever another wave or a different type of disease that's going to happen, as if, you know, this is the new era of world wars that is coming, as Bill Gates predicted. So I guess the only solution is that we have ourselves and our organizations well prepared, especially the healthcare sector. And I think this is really a great time for all of us to try and align our innovative efforts and coming together as a whole to try and test what could be potentially the solutions to navigate such a hard time.
Thank you very much, Dr. Sufana, for your insight. Dr. Kamal, would you like to add anything before we close the session for tonight?
No, I just would like to thank you for moderating, this webinar, and also thank, all of the panelists, for, their contributions and clear explanations of the translational research as it relates also to COVID-19, and also to thank all the participants, who were with us today. And I hope that we can see all of you in our next webinar, inshallah, soon. Yeah.
Inshallah.
Thank you.
From my side, I would like to thank all the attendees for their participation and being active and their question. Thank you, the panelists, for your time and your effort to be here and highlight the major achievements in the kingdom and globally, and what is the state for Saudi Arabia in particular to face the pandemic. I would like to thank you all for being scientists, for being ladies, for being brave, and to contribute all to support science and women in power in Saudi Arabia. Thank you also for the organizers. We cannot forget Dorothy and Nadia and Teresa behind the screen for organizing this and the effort, and Dr. Kamal, of course. I wish a lovely evening for all of you, and thank you very much, and hope to see you all in our next coming webinars. For people who ask about IBK and how can they join, there will be next webinars organized for such a purpose, and you can search it online, Ibn Khaldun Fellowship, to see what are the requirements to apply for 2021, and it will be open October 1st. Thank you very much, and good evening, everyone.
Thank you.
Thank you very much.
Thank you.
Thank you.